We could use a chance while Claes Martinson, Swedish arm wrestler, Swedish best physio is here, and we could talk maybe a little bit about injuries and how to deal with them.
Yeah.
Because surprisingly, we both are physiotherapists, and both have terrible elbow pains, shoulder pains, and wrist pains, and it seems like our theory is not working. So
No.
What would be the advice you would give to yourself, but the advice that you would ignore?
Go easy at first. Listen to the pain.
Listen to the pain.
What the pain saying?
The pain says, "What the fuck are you doing?"
Like John said before fight with Alexei that, he have said that before that at his age it's no more strength management, it's management of pain.
Yeah.
Is it true?
Yeah, you cannot be strong if you have pain.
Absolutely. Pain is blocking. It's self-saving.
It tells you
and
not
it's blocking.
to. Yeah.
If we talk about elbow pain or classic arm wrestlers most often have inside elbow pain, golfer elbow, medial epicondylite, all different names for pain in inside elbow.
Similar spot.
Yeah. What like a few things you would suggest for athletes who have this problem?
To release the tension, because the pain from the tendon comes from it's never relaxing. So you have to release the tension. And
in the muscles.
In the muscles. There are different ways to do it. And but the funny thing is that you need pain to get stronger also. So
training is stressor.
Yeah.
You need the stress for structure, for tendon, for bone, for everything to get stronger. But the question is how good the structure can adapt to the stress.
Yeah.
And if it's too bad pain, generally it shows it's not adapting well.
Exactly. And the problem is when we get older, we don't get the same hormonal levels, so it takes much more time. You have to be much more careful with how much alcohol you drink and
your recovery, your sleep.
Sleep becomes super necessary. The older you get, the more important. But if you could go back in time and be careful with those things, you would be a better athlete. In the future. Yeah.
What do you do after practice, after workout? Do you do some soft tissue work on a muscle, or do you do some blood flow exercise?
I should do it, but
stretching?
I cannot brag about doing it. I can tell people what to do, but to do it myself, that you are the expert in doing the shit you talk about. I'm bad at that. Yeah.
But still you suggest for your club mates or your students, you have some youngsters in your club.
Yeah.
And
I've had the worst pain and I'm the guinea pig of myself. So,
What's the best to stretch? What thing you should stretch to get some relief in elbow? What you should stretch? Or do you really think stretching at all is necessary after?
I think I wait a little and I don't do it directly after. Maybe I do some massage more than stretches. If I feel something's bad, I do contract, relax stretching. And I try to figure out which muscles are sore and I work on them.
Very, very similar. I don't like to stretch too much directly after arm wrestling or after workout. If I do some stretching session or some health session when I do stretching, it's usually just some hours away or another day, but usually not together with the strength training.
No.
And can we show some few simple things? Right. Yeah. For example, what I like to do, one thing I try to for a biceps together with elbow flexors, with wrist flexors against mirror. Up, and not only to stretch forearm here, but also as much as possible rotate your elbow forward and press forward here with chest, so to relieve this one. Or I just hold this position. Sometimes I press against wall to have this static contraction, and then after that release and stretch. So it's like post-isometrical relaxation when you have contraction, after that stretch. Sometimes I do dynamical when I push forward, rotate back, push forward, rotate back. and do those motions.
Yeah.
Just one of things.
Super interesting. When you do that again, and you can also, when you feel discomfort here, I usually check the pecs also,
yes, exactly.
because the nerves going out here comes from beneath this shit. So if this is too stiff, you have to release this, and you can do it with a stick coming up and lean on it, or you can have a friend doing it, or you can do it yourself, or with a massage gun shooting this, and you will release the pressure of the nerve and have a better feeling.
Yeah, the nerve comes to arm. It's through scalenus, front and middle scalenus, under collarbone, under pectoralis minor, and under small chest muscle. So generally under chest, and then it goes to arm.
Yes.
So if all this upper part is too tight, could be problems in your
that could be the
arm.
reason why you lose and you are weak also. So
yeah, very possible.
yeah.
Not always it's possible to relieve tension with stretching. So other thing, like you mentioned, is already to work with soft tissue.
Pressure massage. So.
Yeah.
Yes.
Yes.
Yeah,
so what we can do with different types of those myofascial relief. Again, find some points. If it's elbow problem, very possible problems could be in flexors. Very possible some triceps, medial head of triceps could be overworked. Could be as well from chest muscles. So you can try to find some tension points here in a flexor group, in pronator group, all muscles which are connecting to medial elbow. You can slowly release them. You can hold on some points. Work with some motion here. Not directly on elbow. You don't need to press on bone. You can also, sometimes with ball, sometimes roller maybe is even better. You can work with medial head of triceps, and by releasing soft tissue under and up the elbow could feel better or should feel better. So you can work here, you can work motions here, and you can also work on, like Claes mentioned, this chest muscle. Okay, I will press here, so you can come here from side. You can find those points in the chest muscle, and you can up or down, or if you find some tension points, you can move up with elbow by stretching. Generally, you're pressing, and every time you lift your elbow up, you are stretching chest muscle and releasing. So.
And sometimes if you feel pain from contracting these fingers, I do the lat also.
Yep.
Because here we have a lot of connection with those muscles. For a hook puller that has tension in the lat, you can almost feel them getting numb when you're doing soft tissue here. Yeah. And it's super to do dry needling also on those muscles.
All this medial side of arm could be connected with lats, and also actually
infraspinatus.
Yes, teres major, teres major, and subscapularis. Internal rotators also here in this position could give you pain, and you can to have those trigger points almost in armpit, like centimeter or two below armpit.
Yeah.
Very classical point, and also below and
And this one hurts like fucking crazy. But
absolutely. And again, roller is as well.
Also,
let's go. I will show.
Like Claes is watching too much mask.
Like I do it maybe on a without too much, but just using my weight here, and I can press again on lats. I can hold on some positions. I can slowly up and down. I can use some arm motion movement to release that.
You can have a slimmer version also, like a bottle of wine. You don't have to drink. You don't have to drink it first.
You know that bottle of wine always helps.
Yeah.
For almost
but
every
it's the perfect size to do this. If it's too painful, just have a sip.
Some pain relief before and after, and after that is perfect. You mentioned dry needling.
Yeah, awesome.
That's another good or great thing to work if you find those trigger points and then
you can really go into them, and it's like putting a nail in a tire. You release the tension.
Yeah.
It's sometimes difficult to massage a tire to get soft, but if you put a nail in it,
exactly, like balloon.
Yeah.
And those are great things, but we are talking about not reasons why it's happening. It's mostly like
What to do when it happens.
Yeah, because
Exactly.
it will happen.
it will happen.
Yeah.
But always best is to be prepared for those stress, to work and train and to strengthen your structure that it can hold those stresses. So because structure need to adapt. But still, injuries happen, working happen, this tension it will happen, and everyone definitely in arm wrestling.
I think it's one of the reasons why you are successful in this club, because you guys have always been interested in things like this, and you have always taken care of.
Yeah, it's big part of success.
Yeah.
If you can be super strong, but if you are getting stronger for example a year or 6 months you're getting stronger, then you get injury, and 3 months you are recovering, or 6 months you are recovering, you're down again, 3 months, 4 months you're getting stronger, again injury. That's a problem if you are, especially for youngsters. I could say that all our successful youngsters, they have been probably healthy for first 8-10 years or so, and like Vlad Krasovsky, he didn't know what is elbow pain for 10 years.
No.
And that you can just get stronger.
Every year, every month, you can be without pain, and you can put those training hours instead, with quality.
Yeah, and I often say that there are, of course, acute injury when you just go and fall and then get some arm break, but those overuse injuries, it's also planning. It's training planning. It's your training methodology. How you analyze, how you plan your training, your workouts, and very often it's wrong planning of
and stupidity.
Stupidity.
You come and you see this guy you want to pull, and you feel pain, and you just want to go anyway because you are there. Good
that we are not stupid and we don't have a pain. Stay strong and love arm wrestling.
Love arm wrestling. Yeah.